Hi guys, so today I'm going to do a video about my quick tips for nursing interviews. So by nursing interview, I do mean interview for nursing university, so before you've actually started, as opposed to if you're coming to the end of nursing and you're going to go for a job. So just a brief intro, I'm Keen. I have applied for nursing twice in my lifetime. The first time I got rejected and thought it would never happen for me. The second time I kind of sailed through the process, and I will be starting in September. I'm very, very excited. I am counting down, literally. I know that there is 57 days to go, but less of that, let's get into this video. Some of you might be watching and wondering why I think I can give advice. I'm not saying that everything I say is absolutely perfect and will fit for you. It's things that I found important. I did have an interview many years ago and was rejected, and then went back and tried again. It's things that I learned and then applied to the interview, which seemed to make me go straight through as opposed to getting told no. So now I'm going to give you my do's and don'ts for a nursing interview, or I guess nursing interview preparation. Do get experience. And when I say experience, I don't just mean healthcare experience. It could be any kind of experience in work. I know a lot of people do go into nursing at a very young age, so say straight from college and straight in, which is obviously fine. I'm not disputing that those people make excellent nurses, but what I found was having experience in different areas gave me the opportunity to actually learn how to communicate with people and deal with stress. Healthcare experience is where I found the most value. I worked in forensic mental health, so that was really important because we were working with mental health patients who came from prison to our unit and then went from there in terms of treating them. I got to see what a mental health nurse actually does on shift, and I guess what a mental health nurse does in a forensic setting. I worked for the ambulance service, taking calls, learning how the ambulance service is structured, how we take the calls, how you assess how the needs of the different ambulance categories. Currently I'm working for local authority, which again is really great experience. It helped me in my interview to explain that I've seen various aspects of social care and healthcare. Don't memorize the job to the point where you sound like Siri. Now that is something I did in my first interview. When they asked me what a nurse does, I rattled off every single bullet point I think I've ever seen on the internet. I probably just sounded like a robot who's read the job description a million times. At the time, I was working at, I think, a supermarket, but going in there and rattling off that job description didn't really win me any points, because when I got rejected, one of the notes on there was that they said I did not know what a nurse does, which baffled me because I rattled it off to the point of the dictionary definition. The second time round, when they asked what does a nurse do, I was able to talk more about what I've seen them doing when I've been working, how I've worked with nurses at the ambulance service on the phone, how I've done referrals in social care. So it was a lot more organic, and I think it made me sound like a real person, not a robot. I would obviously learn what a nurse does, but try and communicate it in a more discursive way, or go based on your experience with nurses in real life. Do surround yourself with like-minded people. Now I know it's not possible for everybody to go grab a nurse and follow them around all day, but you could just surround yourself with people who are also interested in whatever field of nursing you're doing. So for me, because I'm interested in mental health, a lot of my friends are interested in mental health. My cousin is going to be doing an art therapy degree soon. My partner actually works in mental health. And then there's also been a few issues within my family with substance misuse, etc. Surrounding yourself with like-minded people is a good way to stay in the know about what's actually going on in that area, and also just to be able to unknowingly be prepping for your interview. The chances are, if you surround yourself with people that are interested in those areas, you're going to talk about it at times, which means that you're actively learning as you're talking with them. Don't recite the 6 C's. Now I've watched a lot of interview videos. I watched a lot of them for my second interview. I also did the same thing with my first interview. With the first interview, when they asked what it takes to be a nurse, I rattled those 6 C's off, thinking that I have just smashed it right out the park, and that is exactly what they want me to do. But again, this goes back to what I was talking about earlier, about not coming across as a complete robot. So what I did this time round was I learned the 6 C's, but I applied them in a less, hey, look at me way. So when I was giving answers to things, I would mention care and compassion, etc. But I wouldn't just list them and just look at them like, yeah, do I get the place? So yeah, learn them, but don't just word vomit them in their faces. Do have an understanding of which area of nursing you want to go into. People that just think, I want to be a nurse. I mean, there's so many different roles that nurses can do. For me, it was very much, once I did the forensic mental health work, seeing what mental health nurses do, I was just like, yeah, that's the one for me. To be honest, I'm a bit squeamish, so I don't think that anybody wants me to be around them when they're doing wound dressings, etc. Don't do it for the money, because I think that everybody deserves a nurse who cares about them. I have seen some amazing nurses who just, everything they do is just incredible and I adore them and I'm just like, wow, you're amazing. Then I've seen some terrible nurses who are really cold and standoffish with patients. I remember asking a nurse, you work a lot, you're always here, you must love this job. And it was, no, I get paid more if I do agency hours. You should only do it if you care about patients, because that is how we end up with a nice, positive workforce who care about the patients. Do talk about your personal experiences. My first interview, I kind of mentioned that we had substance misuse issues within my family. I mentioned it in my personal statement. I kind of touched on it in the interview, but I didn't really go in too deep because in my mind it was like, no, don't be too personal. Like, you don't want to scare these people away. You need to seem really professional. So the second time around, a big change that happened in between is that I was diagnosed with Crohn's disease. It is an autoimmune disorder that I will have for life, and I manage with medication and changes to my diet. This time around, I talked about Crohn's disease and explained how it gives me first-hand knowledge of what it takes to manage an illness day to day, to be liaising with nurses every few weeks, having my bloods done, etc., and constantly trying to navigate something that fluctuates. And I think it's just good to be able to communicate what you've been through and how you would apply it to nursing. So taking those experiences, for me, I can look at a scenario where somebody might be feeling really fed up or sick of having to speak to healthcare professionals and understand totally how they feel. Again, if you've got a history of mental health issues, anything like that, I would think about how could you take it and use it as a strength, because that's what they are. It's not going to hold you back. I believe that it is a strength for me that I've had this illness and that I can have that fresh perspective, I guess. Don't worry about your age. This is something that I see a lot. I'm on a lot of the nursing forums and I see a lot of people comment about feeling like they might be too old to go and do nursing or even too young. I think in general it is good to get some kind of healthcare experience before you apply, although it could be proved otherwise, because a lot of nurses don't do that and they qualify and they're amazing. I guess replacements are experienced too. But when I went for my interview, I was a lot younger. I didn't really have a lot of life experience. I think that probably came across as well in my interview when I was trying to talk about things that I do in my everyday life. So it was those standard answers you get taught at school, where I was like, yes, I go to the cinema, yes, I sometimes swim, yes, I walk down the street smiling and waving. Whereas when I went back again, it was just kind of like talking normally about the things that I do in London, why I love living here, what I like about diverse communities, etc., etc. Diversity in a healthcare workforce is a massive strength because people like to feel like they are represented in that workforce. So if you go to see a nurse or a doctor and someone is your age, it's almost a comfort. But then if they're not, it's not the end of the world, but there's normally some kind of common ground you can find with someone, but that only happens if we have a diverse workforce. So don't worry about you being too old or too whatever or blah blah blah. Do involve nursing in your hobbies. Your hobbies obviously aren't going to be going to the wards and hanging out with sick patients. That's not a very good hobby. It's not a good way to do it. If you're into reading or watching films, documentaries, then try and find things about the topics that you enjoy in nursing. So for example, I love reading, so a lot of my books at the moment whilst I'm waiting start my nursing are about mental health issues, substance misuse, alcohol issues, psychosis. Just try and sprinkle a little bit of nursing into everything that you do somehow, and it's all beneficial because it all gets absorbed by you and then will be expressed in your interview without you even realizing it. Because I'm telling you, I prepared, probably more so for the first one. I read everything you could imagine. The second one, I went in a lot more relaxed because it was kind of like a foundation of knowledge in my mind that I could just pull from when they asked me questions. So I hope you enjoy my tips. If you've got any tips that you want to share, then obviously comment them below and I will always reply. If you liked it, then give me a like. And if you want to see more of my videos, then obviously hit that subscribe button down at the bottom.